you're able to get me. Hello. Are people able to get me?
Yes, I can get you.
If there is any feedback, any lag, all right, awesome. Has already been said, we sincerely apologize for starting late. And I hope this meeting will be helpful for all of us. We'll try to work within the time stipulated. And I should assume all the presenters for the day are available. So my name is Chimuka Mlea. In Medicine Made Easy, I'm one of the tutors. Okay. There's a bit of some feedback. Okay, I think now we're good. So in Medicine Made Easy, made ridiculously simple, I'm one of the tutors and I'm the technical advisor. So I will welcome you all to this wonderful orientation meeting that we're going to have. It is going to be a very interactive meeting where we are going to learn a lot and we're going to get a lot of insight from our seniors, from the doctors and the people who have been with us. People want to see me. Okay, so the program is organized such that we're going to have someone of us. I'm not in a place which is well lit, so if I switch on my camera, you will not be able to see me well. Otherwise, in the course of the presentation, you'll be able to see all the tutors for Mmrs. Yeah. Hope that is sorted. So once again, thank you so much for joining and for being patient, waiting on us to finish our technical challenges. And now we are here, and I'm sure we're going to have more than 100 people. So to begin the meeting, I'm going to take you through the program and just to let you know what you should expect. We're going to be very strict with time. We're not going to, but so in the first session, we're going to have finished. They have been through third year, they have been through fourth year, all the way until they have graduated. They're going to have just some little time to give us some advice on how to go about medical school. Then from there, we're going to have our immediate seniors who are now the third and the fourth years, who are just in the year you are right now. Chipo, who's going to talk about school pressures. She's an incoming 7th year medical student, and she understands, and she's a specialist at mental health, and she understands school pressure, and will give us a few tips on how to handle medical pressure. Then we're going to have the most important part of this meeting, which is the introduction to all courses, where Frank is going to come in. Dr. Frank will come in and give us guidance on the courses and what we should expect as we are going to start our year. That is how our program is going to run. And all these are going to take, each person is going to take about just 5 minutes, and we move to the next one. So a tutor in Mmrs also to just give the opening remarks. And then from there, I'll invite the first doctor to come on board and talk to us. Frank, you can just give opening remarks. Dr. Frank. Hello. Let's please try to keep our mics muted.
All right, Chimuka, since we have already delayed the people, you can continue with the. I'll be the one to talk with the student at the end of this meeting, so I'll have a lot of time to to say whatever I wanted to say, but let's just proceed with the meeting for now, straight to the actual things.
On Mick, Dr. Mick Muller. Let's keep our mics muted and we pay attention as she's going to give us her presentation. Dr. Mick, your time, please.
Thank you so much for giving me this opportunity, Mmrs. Can you hear me?
Yes, we're able to get you, Doctor.
We can get you loud and clear.
Thank you. As earlier introduced, my name is Dr. Mick Muller, and I'm a recent graduate, doctor graduate from the University of Zambia. And I would love to congratulate you guys for being selected into this beautiful Unza School of Medicine. As you know, it's a very competitive school, and you know that a lot of people were left out. And so for you to be selected here, it means that you really deserve this. So congratulations. I'm basically just here to tell you about my medical experience, being a student in the University of Zambia School of Medicine. There's a lot that we've walked through this school, and the old curriculum required us to do our medicine for 7 years. But at least now that it's been pushed to 6 years, I think that's a good thing. At least you will still have a year to preserve your youth. So some of the things that I'll talk about, number one, please leave the 6 points that you got from your schools at the gate. Immediately report on campus when we open next year. Leave whatever glories that you had from your previous school. Okay. So you might have been the best student at your school, but when it comes to UNZA, that does not matter. It's a level ground. So whether you see, no, there's this genius, if you even feel intimidated, no, there's a genius there. Me, I wasn't doing well when I was in school. I don't know if I managed this med school. Right now, UNZA has awarded you guys a ground zero. So it's a level ground for everyone. You're all starting from scratch, okay? So whether you were a best student who got awards or you're someone who never got awards and just found themselves in med school by luck, just because you managed to work hard for the 6 points at the end of your grade 12, it's still a level ground and you can still work hard and your way up, okay? And the second thing is be a fast learner. UNZA requires you to be a fast learner. They do not care about how many hours you have to put in a day for you to understand. What they care about are just results. So what it just requires you is you have to be a fast learner and be someone who is always doing their work. This school that you've come in, as earlier mentioned, it's a compressed form of academic years. So they really expect a lot from you guys. Some things that we used to do in second year are now being done in first year. So you really have to work hard and you have to be a fast learner if you're going to catch up with everything that is going to be happening in school. Thirdly, interact with your peers. What I mean by peers is your friends, so the ones that you've come into school with, your fellow first years, as well as your seniors. So your seniors start from second year, third year, fourth year, going all the way up to sixth year and some 7 years. Respect your seniors, respect yourselves, respect your fellow colleagues who you are in the same class with, okay? And as it is usually said, they say one can go fast alone, but they'll go further when they have a friend with them, okay? Because when you get tired, you'll be holding each other's hands. And trust me, you really need to be working with someone, okay? You cannot do medicine alone. Even when it comes to the ward, we do what we call a multidisciplinary approach when it comes to working on a patient. So you find that a doctor will come to review the patient. The nurse will come because, nursing care, they're the ones who are always available for the patients. A pharmacist will come and prescribe and will advise, no, this is the best drug that we have to give to this patient. And if the patient needs some form of exercises, you know that physiotherapy will come in and they'll help that patient get better. And if you need some lab results or if you need some certain tests and someone's knowledge on what tests to be done on that patient, a biomedical scientist will come in. So when it comes to this profession that you've come in, it's all about working together. In medicine, you never work alone. You'll never find a doctor working alone. Even if it's one doctor, if a doctor can be specialized in this thing, they'll still ask another doctor who is specialized in another thing so that they can help them manage the patient better. Because at the end of the day, what you've come in is for you to ultimately be able to treat the patient that you'll be in front of you. Okay. So this thing of no, I've been studying alone. And I know most people coming from your schools, maybe you felt like maybe studying alone and doing past papers on my own was okay. But this school that you've come in, it does not allow that. Okay. So, and we have several doctors here. There's Dr. Frank and Dr. Chimuka. We were all in the same study group together, and we've worked together, and we're now graduates. We're celebrating together because we work together. And this is what we want to see. And it's what has been happening, especially in medical school. So people have been working together so that they can proceed and graduate together. And my next point is, do not be intimidated. So you find that, as I said earlier, when you come to medical school, some people it will be easy for them because I said it's all about being a fast learner. But other people, like, you find yourself that you're not grasping the things as fast as you're supposed to do. So even if you don't do well, do not be intimidated, okay? And don't be ashamed to ask for help, okay? So one thing that someone can do is you have to accept your failures, all right? Accept that you haven't done well. Let's say you maybe wrote a quiz in chemistry, like the basic sciences that you'll be doing in first year. You wrote a quiz in chemistry and maybe let's say you get a 5 out of 20, you know, like you just don't get the pass mark. Do not be ashamed. Go and look for that person who's done well and ask for help from them. Okay. And do not wait until at the end of the academic year for you to realize that you actually do not know what you are doing. Okay. So what you have to do is ask for help immediately. Okay. And your seniors will be able to help you. And I think that's why MMRS is here, because the thing is, we're a team of medical doctors, okay, and who just graduated, and we know how medical school is. And that's why we're here to help our juniors, and we offer mentorship to our juniors because we know what med school is all about. And that's what we want you guys to also continue doing for your juniors as you proceed in this career. Okay. And last but not the least, the brain gets tired. If you're that person who is always studying, you will not remember what you're studying. And the trick about medical school, or just the trick about being at UNZA, is you'll be able to remember something that you've understood. But then one would ask, how do I help myself be able to understand the things that I'm studying? You need to give your brain some time to rest and you distract it. You cannot, it's been proven scientifically that you cannot continuously just be on your PC, just reading things about science. Find some extracurricular activities to do. Okay, because by doing some extracurricular activities, you'll be able to help. Someone is asking if it's for upcoming first year or second year. It's for both, because some are coming to UNZA now and then others are going into second year. Okay. So just to continue on that, yes, I was talking about extracurricular activities. So when it comes to medical school, I remember I was a part of a lot of organizations in school, and I still am. So there are things like Daisy Care, there are sports, there are a lot of debate clubs, you know, and now we've even introduced arts. So like find yourself in some form of extracurricular activity. And for those who are Christian, engage yourself in church activities. Maybe you can join a choir, a praise team. Engage yourself in other things that will just distract you from school. Because trust me, it gets stressful. So there are issues like things like, let's say you've been doing anatomy the whole week, and then just find something to distract yourself, like just to not think about anatomy and not think about physiology. Okay. I would also advise you to make some form of investment. I know this is something that they don't advise us or tell us, especially when we enter into med school or continue in med school. But you really have to invest in things like to earn some money. You don't want to graduate at the end of, let's say, sixth year and you're broke. So find a way of investing, finding a business. And I'm proud to say I'm a makeup artist by profession. Yes, apart from it being a doctor. So like if you find something where it can give you some money, please go ahead and do it. But do not let that affect your academic activities, because at the end of the day, you have to pass, and there are patients will be waiting for you at the hospital. Okay. And so, just to end with my remarks, you are the best, and that's why you are picked by UNZA. And always remember that. So do not be intimidated. Work with your friends. Do not feel shy to ask for help, because this requires a lot from you. Thank you.
Thank you so much, Dr. Mwila. I hope so far we are learning quite a lot and we are following. The next person to speak to us will be Dr. Simonga Chimuka, who was the president in 2022, who's the outgoing UNZASU president. Dr. Chimuka Simonga, sir, you can come through. Dr. Chimuka, please. Okay, we can have Dr. Emmanuel. Dr. Emmanuel Kayumbo, you can come through as well, waiting for Dr. Chimuka.
Okay, so good afternoon. Is it evening now to everybody? I don't know if I'm audible enough. Can someone just help me confirm that?
You are audible.
All right, thank you very much. I didn't hear that. Someone was trying to say something.
We can get you.
All right, thank you very much. I just needed that clarity. Okay, like I've been introduced, my name's Kanyumbu Emmanuel. I would have loved to speak before Meek, because Meek is, but anyway, I'll have to shadow in on what Meek has already talked about, because literally it's like she was reading off my mind. So I'm one of the students that is graduating as well from the class of 2022, 7th year, and we are getting into internship now, or becoming doctors into society. I'll be very brief because of our time, but generally, firstly, I would like to congratulate everybody who's made it to, is it second year or first year? The curricula has changed now, so it applies to both. You're very much welcome. The first thing that I would want to say is we are graduating now, but we started with the little steps that you people are taking right now. And at the time, especially back then in first year, you don't really see that what you're doing is important, or rather you don't relate what you're doing now with what you're going to be doing up in 7th year. So we all started from there, and I want to encourage you, I want to appreciate you for loading on to MMRS. MMRS, of course, has been and will be introduced by other people. I was a tutor under MMRS this academic year, and I had a flood of messages on people applying yourself. Okay, so it's the first step in applying yourself. Now, one thing about medical school, like Dr. Mwila has said, it's something that you cannot do alone. Even if you are, I've seen some brilliant people, but they still have to work with other people. Now, what do I mean by applying yourself? Number one, academically. Okay, so in terms of academia, what I came to learn in med school, through my journey of med school, it's not really how much you study that matters. Of course, it does matter to study a lot. But what really matters is, are you studying the right materials? Are you studying the right way? Are you taking the right approach? Now, those three things come from an aspect of applying yourself academically. What do I mean by that? You need to know how to navigate through med school. And the only way you're going to do that is through applying yourself academically with your seniors. One step you've already done is applying yourself with MMRS. Not that praising MMRs. Of course, we have done our part, but what I mean is you need someone who is going to help you navigate through the heavy stress and the academia that is required of you through med school. You need someone to help you to know how to study, to know what to study, and to know how to prepare yourself for exams and tests. I've come to learn through my years that it's not how much you study. You can study all you want, and one person out there is getting advice from their seniors, they're applying themselves, and they will end up doing better because they know what to touch, they know where to read, and they know what materials and what is expected of you. In your class or in your exams, most times you realize that, or you will come to know that your tests or your grading system is more than just the theory that you learn in class. And therefore, that is why your seniors come through. That is why, things like MMRIs comes through to try and help you navigate through med school. So number one, apply yourself academically, apply yourself clinically as well. I was saying that Dr. Mwila has stolen my show because she's literally preempted what I had prepared. But as you are coming onto the market or into the medical field, you realize that the medical industry has literally changed. Now we are talking about licensure exams. We're talking about competition with other schools and the like. So it's very, very important that you apply yourself clinically. You become clinically relevant. Okay, so you don't want to be that person who just passes and guns, and it's very frustrating. It's very, very frustrating. You come and learn that you've studied all your anatomy, and then someone who was applying themselves because they were interacting with their seniors, they were interacting with people who are a little bit further than them, they're able to clinch those clinical scenarios. So you should be able to associate what you're learning in class with what is being done clinically or out there in the world. And one of the best ways to do that, especially here at Ridgeway campus, is you associating and discussing with other people. So seniors, clinically, those people give you guidance. Apply yourselves with your talent as well. Very, very important. I think that's something that has been neglected in the medical world. Previously, we were known to be geniuses, and the only thing that you do is you study at the end of 7 years, you have a job waiting out for you there. Now it's open truth that that's no longer the case. So apply yourselves with your little talents that you have. Other people have ability to braid hair, like Dr. Mick talked about. Other people have ability to teach. Other people have ability, whatever it is that you can do. Don't lose your talent. Don't lose your focus because of med school. Please apply yourself in other income generating activities. Don't lose your talent. When it comes to academia, I only have one thing for you, is know yourself, okay? What do I mean by know yourself? Number one, we've talked about the power of association. Now, when it comes to association, a lot of people think association is just, you go to a group discussion, you discuss. For some people, that might be a waste of time. So you need to literally know yourself. If you're going to go for your discussions, go for your brief discussions, be very, very strategic. Know yourself, study. Please don't get lost by, I know we are advising you on what you're supposed to do, which is very, very important. I believe it's very important. But one person once says, don't be a follower, be a listener, okay? So you listen to your advice, listen to what your seniors are telling you, pick out what best works for you, and follow your path. Don't be a follower. Sometimes, especially when you come to Ridgeway, everybody is studying long hours, everybody is, people are missing classes and the like. So there's all those activities that are present, and what you need to do is know yourself in terms of your association. Who do you associate yourself with? Who do you mingle with? Are you someone who is an introvert who studies or benefits more alone than you do with other people? That should tell you that probably you should spend, of course, you're doing your association because it's important, So you should spend lesser time doing with association and more time on your books. I know of people who, for them, it's just a group discussion. They will go in the exam and they will remember everything. You might not be that person. So know yourself, know your dynamics. And once you realize your dynamics, you will be able to navigate through med school properly. That's all I have to say. In conclusion, my advice is, number one, know yourself and apply yourself in the best way possible. Please realize that the medical industry or the medical fraternity has changed now, and therefore it's important to wisen up, apply yourself, and do the very best that you can. Those are the few words I had for you. I'm sure we'll meet more often and we'll discuss a lot more as we go through the journey together. Thank you very much.
Thank you so much, Dr. Emmanuel. I hope people are still able to get me. So if you have got any questions, anything you want to clarify, I would advise that you please write it down. Then towards the end, we'll ask for questions and any contributions. Dr. Melissa, are you on the meeting? Dr. Melissa, it's your time, please. Dr. Melissa? All right, so it seems Dr. Melissa is not on the platform. At this point, I'll invite our immediate seniors. These are people who are doing the exact things we're doing. As you come to read here, you are going to realize that the people who are going to do much help to guide you on exactly what you are supposed to focus on are the people who are immediately ahead of you. So I'll invite Sarah Said to come through and give us a short talk just for 5 minutes. Sarah Said, you can come through, please.
Okay, thank you. Hello, everyone. I'm Sarah, as I was just introduced. I'm an incoming Med 3 student. I would love to warmly welcome you all into becoming Med 2 students, and I want to share some advice that helped me this year as a Med 2 student and that hopefully would help you as well. Being in second year is very different than being in first year. You don't really have tutorial sheets to help you know what's important and what to pay attention to. This year, you did the introduction of organic chemistry, and you continue with the rest of this course next year. And organic chemistry is the only subject you take in second year that you have tutorial sheets to solve. And by now, I'm sure all of you guys know the importance of solving and understanding the tutorial sheets, but I want to emphasize, make sure you understand your tutorial sheets. This course would be as easy as drinking water once you've mastered your tutorial sheets. However, please make sure you revise what was taught to you this year in organic chemistry. When you come next year, the lecturer will just continue from where you stopped. And it might be confusing if you forgot what you were taught this year. So just make sure you revise on what you were taught this year in organic chemistry. Biochem is another course you would be learning as Med 2. To be honest with you, most of the time, you would just be memorizing the staggering amount of enzymes and pathways. This is not a course you can study last minute. The best advice I can give you is just set a day in the week or maybe in the weekend. For example, every Sunday, just sit down and do like a pathway, and you just repeat this the following Sunday. And in this way, it would help you remember all the enzymes because you're applying spaced repetition and you won't end up piling up pathways. Medicine is very bulky and there's a lot of information. Unlike in first year, as I already mentioned, you don't really have tutorial sheets to help guide you on what's important. This is where you need others who have experienced this medical journey to help guide you. Personally, I really benefited from the help of Mmrs. The tutors provide high-yield notes that help me focus on what's most likely to come in an exam. 4 out of 5 times what the tutors would hint at would end up coming in our tests and exams. The help of the tutors has been very beneficial and invaluable to me. I'm very grateful for their help. I'm sure that they will be just as helpful and beneficial for you too. Thank you very much, and I wish you all the best.
Hello.
Hello, yes, I'm done.
Oh, all right. Thank you so much, Sarah. So
You're welcome.
let's please note that
Excuse me.
we're going to have a question.
Thank you,
Hello?
Sarah. Just a bit, sorry.
Yeah.
Before she goes, I just have a question concerning organic chemistry.
Please go ahead. Go ahead.
Rachel, you can go ahead.
Oh, sorry. Somewhere there's a bit of noise. So I wanted to ask. She said there's just going to be a continuation from where we ended from in organic chemistry, but then we didn't really finish everything. Does it mean that they're going to start teaching us from where they stopped from, or they're just going to teach us different things?
What happened this year is we also didn't finish. We did half last year, and we continued with the other half this year. So they're just going to continue from where you stopped. So it's very important to revise what you did this year. Then it will be easy for you to follow the lecturer as he continues.
All right, thank you.
You're welcome.
All right. Thank you, Rachel, for the question. Do you have any other questions?
No.
All right. Okay, so at this point, I'm going to ask Renzu Milimo just in less than 5 minutes to just give her experience. Renzu Milimo, you can come through.
All right, thank you. And actually it's him. So yeah, I'll just talk about the general life, not really about the courses, but something away from school as a med too, what I've learned and what I've experienced. So what I've experienced, the first thing, as Dr. Kanyumbu and also Dr. Mick, as they emphasized, you're supposed to consult from your seniors. If you don't consult from your seniors, you lose it. In first year, you can only use YouTube and make it, but in second year and the years to come, you can't make it like that. You're supposed to consult because they'll tell you the likely questions and what other lecturers like and what they don't like, things like that. Things like that also help you. And then also talk about involving yourself in something that's away from school, like sports, debate, as Dr. Mick said. Those things are very important because it's very stressful. And then looking at our numbers, for example, you guys are also a lot, and we're also a lot, especially those that are the incoming second years. Yeah, a large number, just the same as we were. So the lecturers are overwhelmed and they have tempers flaring everywhere. So it's really, really hard. So you really need something to help you, like something away from school to relieve your stress and the likes. So make sure that after you reach second year, you're supposed to join just something that will be relieving you from stress. Let's say if it's sports, and also if you're in a relationship, you're supposed to have somebody that's understanding. Because if you have somebody that doesn't understand you, maybe they're doing some other program, it will be really hard and to be some pressure on you, like extra pressure on you. And then the other thing was also the thing for group studies. You're supposed to have a group study at least have a group study whereby you'll be consulting from your other friends. And then School of Medicine is all about bringing together questions, you answer and you revise a lot because it's a lot. This thing is has been compressed, so there's a lot of things for you guys to do. And then also talk about how MMRS helped me. Specifically, MMRS, I would say it's the only existing tuition center that I know that has lasted this long, because most of the tuition centers, they would start and then they stop. They start and then they stop. And then imagine how that will really confuse you. Let's say, for example, you get used to a certain tutor and then they stop. You have to switch to another tuition center. That's really hectic. So MMRS is consistent. And then these doctors, for example, Dr. Kanyumbu and Dr. Frank, these were our tutors, even in class, like the official class, like the medicine class, they were our tutors also in class. So it's like they have firsthand data from the lecturers. So which really means that they'll really help you have that firsthand data also, and then they'll give you what you're supposed to learn. Other than these other tuition centers, they don't even know what's happening because this is a new thing. This is a new syllabus, so things have changed a bit. So a lot of people don't know what's going to happen when it comes to this and other thing. So I'd really advise everybody to join MMRS. Even if you don't have money, at some point you might have some spare change and also pay and then learn. And then they give them a 1 month free. That's a heads up for everybody. Like, okay, it's an eye opener for you when it comes to school of medicine. I think I'm done. Thank you.
Thank you so much. I hope we're all following. So if you have got questions, you can share them in the chat box. You can unmute yourself and ask. We'll be taking questions as we proceed. So if you have got any questions from any speaker who's spoken, feel free to just unmute yourself and ask your question. At this point, I'll ask Wilson to come through. Wilson, please, it's your time. Okay, as we wait for Wilson, Chike, you can come through. Chike. Hello, Chike, are you here? Okay, so we'll not wait for long. If these people are available, they'll come through and give their presentations as we proceed. Chipo Mwanga, you can come through with your presentation. You can let us know if you need to share the screen or anything. Chipo Mwanga. Okay, so we'll go straight to the main program. These people don't seem to give me feedback. As you can see, Dr. Frank is sharing the screen. Dr. Frank, you can go ahead.
All right, just give me 1 minute, guys. You know, I'm not used with Zoom, so I'm orienting myself right now. So I've just shared my screen, and so just give me a minute so that I just settle things, and then we can start. Okay, someone to confirm if you're able to get me.
We can get you.
Yes,
and
we
can
get you,
see the
sir.
slide.
Okay, great. All right, great. I'm sure this is the part where most of you are looking forward to. Well, get to talk about the courses. Okay, so I'm now oriented. All right, so I saw some questions in the comment section. They were asking if this orientation is for both Med 1s and Med 2s. This orientation is specifically for the Med 2s, meaning those that will be coming as second years next year. Okay, not the Med 2s for this year and not the Med 1s, but those that will be coming in as Med 2s next year. Meaning if you're in Med 1 this year and then you'll be heading into Med 2, this particular orientation is for you. Okay, so I'm the one who's going to quickly run you through the courses. Of course, this is something people wanted to hear. So I'll quickly run you through the courses that you expect to find at year 2. Now, the thing is, I like it when someone has an idea of what they should expect as medical student, not just as a med 2, but what do you expect when you become a med 3? What do you expect when you become a med 4? So what I'll do before we dive into the actual courses for the med 2, I want you to have an idea where you're coming from and where you are going, okay? So I'll start with a simple question. Can any of you in our meeting, apart from the doctors, tell us the difference? Because we're all studying medicine. So I want to see if people know the difference between MB-CHB and MBBS. You've been at UNZA for almost a year now. So, and when you're applying, you applied for MB-CHB. But what is the difference between MB-CHB and MBBS? Anyone from the audience, apart from the doctors and the senior students? Anyone to try it out? Okay. Have you guys ever heard of MBBS? I know you know what MB-CHB is. Like most of you probably don't know what it stands for, but you know that's the program you're doing at UNZA. Anyone who's ever heard of MBBS before?
I have a bit of an idea, sir.
Go ahead.
Yeah, so MBBS, it's Bachelor of Medicine and the Bachelor of Surgery. That's what I know.
Yeah, excellent, which is very good. So that was the definition for he was explaining MBBS, like the letters, what they stand for. So MBBS stands for Bachelor of Medicine and Bachelor of Surgery. Now let's get back to the program we are doing, which is MB-CHB. What does it stand for? Anyone? I don't know if people are writing answers in the comment section. I need to be checking. Let me check. Okay, there is nothing. Okay, so there is no difference between these.
Can I try?
Okay, I've answered your question, but go ahead. What did you want to say? Go ahead.
You say, okay. I think for MB-CHB is the one that has human biology.
Oh, human biology, because of the HB there. But remember, the curriculum I changed. Yeah? The new curriculum, the one you guys are doing as med 2s, because you're going straight to the actual medicine. This new curriculum changed, but despite changing the new curriculum, the initials of that curriculum hasn't changed. It's still called MB-CHB, but this new curriculum does not have HB. The reason why the HB degree was removed is because the second year part was removed. For someone to get a degree, a minimum of 4 years is required. So if you say that the other one has an HB, the other one doesn't have, that would be wrong. But let me tell you the answer. There is no difference between these two, okay? The MBBS and MB-CHB, they all mean the same. The only difference is that the CH in our MB-CHB is coming from a word, a Greek word, okay? A Greek word, instead of them using word surgery, they ended up using chirurgia. Chirurgia is a Greek word means surgery. So MBBS and MB-CHB, they all mean the same. The only difference is the CH, which stands for surgery, but in Greek. At UNZA, we use MB-CHB. CBU and other universities in Zambia, they use their degree shows MBBS. It is the same thing, okay? Because these two, they mean the same thing. It means even the curriculum should be the same. That means the courses we get to do at UNZA, they're the very same courses that will be done at Apex. Same courses at the University of Lusaka now has medicine. all these universities that offer medicine, they have same courses. The only difference is how they deliver those courses. The way UNZA delivers those courses to us, to you, the student, I'm no longer a student, is a bit different from how CBU does it. See, for CBU, the curriculum is the delivery is a bit stressful because students are required to take the courses you'll be taking at year 2 and at year 3. The CBU guys will be taking about 18 courses at a go. So that is the difference, okay? The delivery of the courses is the difference. Now that you've been oriented, very important, you know, these are things we usually don't pay attention to, but it's very important to understand what you are studying, okay? So that when people ask you questions, you know what to talk about or say. So we dive into the MBCHB, which is the program you guys will be doing. And remember, this MBCHB starts at year 2. MBCHB starts at year 2, and that is the reason why we introduce MBCHB at year 2. At year 1, those are just prerequisites, something for you to do MBCHB. There are some courses you need to do, which is chemistry, biology, and mathematics for you to start your MBCHB. Now that you've done those courses, it's now time to be introduced to your MBCHB. So year 1 is also called pre-medicine. You are now starting your medicine year 1 as MBCHB. Okay. So at the end of your learning from year 1 to year 7, this is what you're expected to know. Okay. All these 15 thingy, you're expected to know all this. But for you guys, out of all this, as some of us who are done with medicine, we are done with everything. We have achieved all these aims, okay? But for you guys, the key part is this: understanding basic and clinical sciences, okay? This is what you guys will be doing at Med 2. This is what you'll be doing at Med 3, okay? All you'll be doing is trying to understand the basic clinical sciences, all right? So how is the MBCHB curriculum structured, okay? We are now aware that we are using a new curriculum. The old curriculum was from year 1 to year 7. The new curriculum scrapped off the second year part, which was done at main campus. So it means when you're done with your year 1, ideally you're expected to go to Ridgeway campus, which is here. But because of space and the fact that you guys are a lot, I'm told that this new intake that is coming next year is about 3 pin. The immediate seniors were about 1, 2 when you are teaching them in class. I think 1, 2 somewhere there. So because of the numbers, Ridgeway cannot really accommodate all those people. So you just remain at main campus. And remember, as you are at main campus, you are at Ridgeway just residing at main campus because you don't have space. It means even the schedule, the schedule that comes out, you will be following that of Ridgeway campus and not that of main campus. The year 1s are the ones that will be following the main campus one, but you guys as Med 2s, your sessional dates will be the same. We will be following that, the one that is at Ridgeway campus. Okay, so the MBCHB curriculum is structured it's divided into 2. Okay, it's divided into pre-clinical years. Then you have the clinical years. Okay, so the preclinical years includes year 1, year 2, and year 3. So the old curriculum included year 1, 2, 3, and 4. But for the old curriculum, year 2 was scrapped off. So it means the year 3 is now the new year 2. Year 4 is now the new year 3. Okay, the old curriculum. But for the new curriculum, year 1, year 2, year 3 are considered to be preclinical years. Okay. So ideally, first year you'll be at main campus, second and third years will be at Ridgeway campus. But again, like I said, because of space, even your immediate seniors might not even come next year because of space. They might still continue residing at main campus, but still following Ridgeway sessional dates. Okay. So the importance of year 1, 2, and 3 is that it covers the introductory concepts, okay, basic sciences. You are introduced to organic chemistry. Oh, you are introduced to chemistry, physics, mathematics, and biology. At year 2, you'll be introduced to clinical courses as well. So aim is to introduce you to the basic sciences. That is the basis of pre-clinical years. Okay. Then at clinical years, which is now year 4, year 5, and year 6 for the new curriculum. For the old curriculum, it was year 5, 6, and 7. Okay, so this is where now the actual medicine, the actual medicine, you'll be seeing patients, you'll be diagnosing diseases. You are given a patient, and then you are taught to click. By clicking meaning you are taught to ask questions, find out what is the problem with that patient. That starts at year 4 in your new curriculum and year 5 in the old curriculum. So this is where the actual medicine starts from. Okay, at this particular point, it means you would have acquired the knowledge needed for you to understand the clinical medicine. You would have acquired the knowledge in mathematics for you to be able to for you to be able to interpret certain things at clinical level. Okay, and that is the reason why your preclinicals are very important, because if you are not good in your preclinicals, then your clinical years will be bad. You'll be a bad doctor. You'll be failing to diagnose patients, failing to treat the patients, because all that knowledge is important. And in medicine, there's no such a thing as this course is irrelevant. You've seen those memes where they say that in university, we have a lot of courses, some of them are irrelevant. Every course in medicine is important because it's a build-up of, it will build up on something in future. Okay, you will see when I start talking about courses. So let's now talk about the preclinical courses, but the main area of interest, I'll focus on the courses you guys will be taking at year 2. But I want you to have an idea of the courses in general, okay? So for the preclinical courses, you know at year 1, you did your organic, why am I saying organic chemistry? You did your physics, you did your mathematics, your biology, and what is the fourth one? What is the fourth course? Chemistry, mathematics, biology, and math. Yeah, and math. Those were, plus DME. Good. DME wasn't part of the old curriculum, but now they introduced it because of the fact that as medical students, we have issues with communication. So it was introduced at year 1, just like CBU, because at CBU, they do DME, they call it communication skills, that side, okay? The reason why it was introduced is because of the fact that as medical students, we are not really good when it comes to communication. But again, we don't really get, most of the students just gun it and pass their exams like that. So that was year 1. At year 2, these are the courses, okay? These are the courses you'll be doing next year. So there's basic and applied physiology, basic and applied human anatomy and development, medical biochemistry and genetics, immunology and general microbiology. This is one course, okay? It means it has an immunology component and the microbiology component. Then you have behavioral sciences and communication skills. You can see you started with communication skills at year 1. This behavioral sciences, so-called, we usually call it psychology. It has an aspect of communication skills, meaning some of the things you learned in DME at year 1 will be covered partially in behavioral sciences as well. And then you have organic chemistry, and you had your immediate senior giving you advice on how to go about with the organic chemistry. So I hope you took note of that, okay? And then last, you have community-based education and first aid. We usually call it a CBE. So these are the main courses that you guys will be doing next year as Med 2s. In the old curriculum, the very same courses were done at year 3. The only exception is that we never had organic chemistry, because for us, we had year 2, and we had 2 organic chemistries we are doing at year 2, the first half and the second half. For you guys, they removed the unnecessary things and just gave you the relevant organic chemistry needed for you to understand your medicine. So this is the only difference between the old curriculum and the new curriculum. When you go into the other year, which will be your year 3, which is after next year, these are the courses you'll be doing. There's neuroscience. Neuroscience, you just be studying about the brain. Pharmacology, it will be about drugs. I won't dive into the details. There will come a session where I'll talk about this, which is a session I'll be having with your immediate seniors on Wednesday. Pathology, microbiology. So you can say microbiology is coming in again, but again, it will be a build-up of what you would have covered in this immunology and general microbiology, okay? And then you have another course that is only done at UNZA, which is called clinical method and skills. So like I said, we said MBBS and MBCHB is the same, but the only course offered at UNZA is clinical methods and skills. So this is a course where they will be teaching you on how to go about with a patient, like you're trying to mimic on how things are done at clinical levels. So you'll be practicing on your friends, doing some tumor procedures, so that preparing you as you go to the wards, you know exactly what you'll be doing. So this is the only course that is done at UNZA. They don't do it at CB, Apex, they don't do it. And when you go at UTH, you realize that there will be a huge difference between a medical student at UNZA and that the one that is coming from Apex because of the very same course, the clinical methods, okay? And then you have your CB. The details will be talked about later on when you go or become third years. That will be after next year. Then you now move on to clinical courses, which is now the other year. So at year 4, these are the courses you'll be doing. Now these courses, they are based off the departments you get to find at UTH. So UTH has surgery department, it has internal medicine department, it has pediatric department. There is a hospital called women and newborn hospital, something like that. That is where you will get to find obstetrics and gynecology. So obstetrics, you're just studying pregnant women. Gynecology, women alone. Pediatrics, meaning children. Surgery, you know what surgery is. Internal medicine is any person who has a disease that is not surgical and is not a child. Any person who has a disease that is not surgical and is not, that person shouldn't be a child, then they will be classified into internal medicine. Then there's another course, communication skills. You can see that communication skills keeps on appearing almost every time. Huh? The importance of us knowing how to communicate. That's why it's there. So these are the courses you'll be doing at year 4. Old syllabus, we used to do them at year 5. Then when you go to year 5, these are the courses you'll be doing. There's an error there. I should have deleted the hand there. So internal medicine, you can see internal medicine here. It was written internal medicine 1. Here there's internal medicine 2. There's surgery 2. Then there's another course that has been introduced, psychiatry. Mental health, very important, okay? So you do it at year 5. Now, I want to emphasize something. A course you're going to do at year 2, behavioral sciences. Everything you're going to learn in behavioral sciences is like normal, the normal thing. It's psychology, but the normal thing. For example, in behavioral sciences, you're going to learn about personalities, different types of personalities, okay? When you go at year 5, when you start learning about psychiatry, what you learned in behavioral sciences, which was the normal, they now introduce you to the abnormal. Remember, psychology is the study of mind, right? Now, if that mind has a problem, it becomes a disease. And those diseases or that affects the mind, they fall under psychiatry. So that is the reason why you have to pay attention to all the courses as you get to learn, because they will come back, okay? Then you have community medicine, then forensic medicine. So these are the courses you will do at year 5. And then this was supposed to be a 6. I made a mistake here on the typing. So at year 6, again, these are so at year 6, which was our year 7, you only have 4 courses. Surgery, you can say surgery, once you start your clinical year, surgery will be with you. And the surgery goes with anatomy. If you understand your anatomy, you are going to enjoy your surgery. The reason why you're doing anatomy is so that you can understand your surgery. The reason why you are doing your physiology so that you can understand your internal medicine. And you've noticed that internal medicine is appearing at year 4, it is appearing at year 5, as well as at year 6. It's supposed to be a 6 here. I made a mistake, I think, when I was typing, okay, which was year 7 in the previous curriculum. Now that you have an idea of the courses you're going to do as you go ahead with your medicine, let's now stick to the courses you're going to do next year, because that is what is important. Now, before I proceed to the courses you're going to do, it's very important to understand the course codes of your courses you're going to be doing. Whenever this is applicable to the courses you are doing at year 1 as well. Okay, so every course has letters, initial letters. There should be 3 of them. And then those letters will follow numbers. The first number of any course represents the year that course is offered. So you can see that all your courses at year 1, they had 111, chemistry 100, 1000, mathematics 1 something, right? So that is what it means. Then a course that has a 0, remember, a course that has a 0 in it, it means it's a full course. A course that is ending with a 0, should I say. So here we're only focusing on 2 numbers, the first number and the last number. The course that is ending with a 0, it means it is a full course. The course that is ending with a 5, it means it's a half course. The course that is ending with a 9 or a 4, it's a project or a field course. Why do I need to know this? It's very important because a course that ends with 0, it means the input should be times Z. It should be a lot. They are bulkier. They need a lot of reading and studying. Courses that are half course, they are not that bad. Okay, they are not really that bad. I'm not saying you shouldn't be paying attention to them, but my point is, as long as you are following through the advice you are given by your immediate seniors and the doctors, you'll be okay with the half courses. But these half courses, if you just throw them away like that, like the not organic chemistry, the behavioral sciences, many people are not studying behavioral sciences because it was a half course. They threw it away, but the exam came, and most, if not lucky, some of these immediate seniors might repeat the behavioral sciences because they are not paying attention to it. Okay, so it's very important to pay attention to all the courses, but you cannot be studying a half course 5 times, let's say 3 times a week. A half course is okay to be studied once every week or twice. A full course is needed to be studied even 4 or 5 times every week, as you will see with anatomy. So that is the reason why it's very important for you to understand the 0, the 5, and the 9, and the 4. CBE, community-based education, ends with a 9 for the new curriculum or 4 with the old curriculum. It means it's a course that no one will fail as long as you do what you are required to do. They tell you to write a report, just write the report and submit. It means you're not going to fail. It's not a graded course. You are not going to be given grades on this course. By grades, I mean, you cannot say I have a 3 in CBE. You cannot say I have a 5. They'll just say, they put S, I think. That's what they put, okay? So it means you shouldn't stress with these courses. You actually have to enjoy your life. Any course that ends with a 9 or a 4, okay? So these are the courses you'll be doing next year, and these are the course codes, okay? So physiology is PGY 2310. You can see that it is ending with a 0. It means it's a full course. And because it's a full course, it means you need to put in more effort for you to actually pass physiology, okay? Han 2210. So Han 2210, again, is ending with a 0, means it's a full course as well. Now, the bulkiest course amongst all these is obviously human anatomy, as you will see later on as we move. Then biochemistry. In the old curriculum, biochemistry was a half course. Biochemistry for you is a full course. The reason why biochemistry is a full course is because, remember, in the old curriculum, we used to do biochemistry at year 2. And then we come and do biochemistry at year 3. Now, when they're coming up with a new curriculum, those things we used to do at year 2, they got them added them to the biochemistry at year 3, and then they came up with a new course, which is a full course for you guys as Med 2s. So it's a full course. And if you just, it means if you have to be studying it, okay, the way you'll be studying your physiology is the same way you should be studying your biochemistry. But most of the time, people usually don't really get to study biochemistry that much because of the lecturers they have. Lecturers don't really pay attention to, like they only have like 1 lecture per week. So, you know, it looks like it's not a full course like that. It's pressure free. Not until you get to write your exams towards the end. That is when you realize that, okay. Then you have your immunology. You can see it's ending with a 5. It means it's a half course. And as long as you just be attending classes, reading Mrs. Mara's notes, Mrs. Mara is the one that will be teaching, Madam Mara, I call her Madam Mara. And Miss Dr. Mumbula, Mulowa Mumbula now. Yeah, so those are the ones that will be teaching you this course. As long as you're reading their notes, and those that will be on MMRS, their notes plus the MMRS notes, you don't really need to stress with immunology. Behavioral sciences, you have Mrs. Incheka. She's a very good woman, a very good woman. She knows that in medicine, my course shouldn't stress students. She even says it in class. But just make sure you don't miss classes. You know, whenever she has a class with you, attend those classes. And on MMRS, we have tutor Chimuka, the very same Chimuka who has been running, the one who has been conducting this program here, is the one that will be teaching you this course. He loves behavioral sciences. Then you have organic chemistry. You can see it's a half course. And then DME, like I said, it's a project, it has a 9. So no one should stress with DME. Just do whatever you are taught to do, write a report, then you are done. So now, it's important to go through these courses one by one, and then we try to emphasize some of the things, okay, the do's and the don'ts. But before I proceed to the individual courses, I'm not going to go through all of them. I'm going to go through the course, the courses, the high yield courses, should I say, and some of them I'll just peruse through. But before I proceed, do we have any questions? Well, good. I can go ahead.
So I have a question, sir.
Yes, go ahead.
You were talking about half courses, like how long do they take? Like they take first semester, like, or it's just first year?
Question.
It's just a year.
Good question. So before I answer your question, I want you to pay attention to say that the course codes for these courses, they come based, they come based on which departments gives that course. For example, PGY, we have the physiological sciences, Department of Physiological Department of Physiological Sciences. There is a department at Regio called Department of Physiological Sciences. All the courses that are coming from that department, they start with PGY. So PGY 2310 is a physiology, PGY 2320 is biochemistry, meaning these courses, they come from the same department. Anatomy is Han, and there's only one course in that department. PTM is pathology and microbiology department. So this is where this course is coming from. PSY is psychiatry. You can see PSY stands for psychiatry. It means even the psychiatry course starts with PSY. So behavioral science and communication skills come from the psychiatry department. CHE, you even know for sure that it comes from chemistry department at main campus, okay? Now, all the half courses at Ridgeway campus, you write your exams at the end of the academic year. It's different from how main campus does it. For example, chemistry, this chemistry, because it is offered at main campus in the Department of Chemistry, it means you are going to write the exam for this around maybe July, June, somewhere there. And then you'll be done with it. Then that's it. But these other half courses that are found at Ridgeway campus, learning is throughout until, is it November, December, and then you write the exams together with the full courses. I hope I've answered your question.
Yes, I've answered.
Good. Okay. Any other questions before we proceed? Because I'm now going to start talking about individual courses one by one, the details, the things you need to know, what to be aware and the like.
Sorry, Doc. There's a question in
Yes.
the comment section. Someone is asking, when the question reads, when do we specialize?
Oh, when do we specialize? Okay. So I was talking about these courses. These are the courses you're going to do throughout your academic, throughout your medical years. When you are done, this will be your year 6 or year 7, the one that is written for it was supposed to be 6. When you are done with this, okay, like the way I am right now, I'll become an intern doctor. Okay, all of us, the Dr. Mwila, Dr. Kanyumbu, will be intern doctors. Okay, once we become intern doctors, what does it mean to become an intern doctor? It means we will be practicing medicine, but under supervision, meaning because we were students, right? We are now allowed to practice medicine, to be attending to the patients, but there should be a consultant around as we practice medicine. And we're going to do that for 2 years. So internship is 2 years. Within that 2 years, the departments I'm going to be rotating in are the very same 4. Internal medicine for 3 months, pediatrics for 3 months, surgery for 6 months, obstetrics and gyne for 6 months. That will be my internship. But the good part is that I'll be paid. It's like I'm working. It's not like I'm schooling. It's both schooling plus working. So I'll be paid, I'll be working and getting paid for 2 years. Once I'm done, I'll now get a full license from the HPCZ. And when I get a full license, I can now come back to UNZA. I'll be like, I enjoyed surgery when I was rotating. I really did enjoy surgery. And then I can come back to UNZA, apply for Mmrs. It's called Masters in Medicine. And then I'll pick surgery. Then again, it's another 5 years of studying. Okay, so that means I'll go back for another additional 5 years. Then I'll do surgery, for example, and then I'll become a surgeon at the end of that 5 years. That's how it is. Or if I want, I'll go and do pediatrics for 5 years. By the way, surgery differs. It can be 5 to 7, depending on what type of surgery you do. Pediatrics, I'll go back for another 5 years. At the end of that 5 years, I'll become a pediatrician, meaning I'll narrow it down. Remember when I was done with medicine, I was everywhere. If I'm a doctor, I'm a general doctor, and I'm put say Kawata clinic, I'll be attending to pregnant women. I'll be attending to adults. I'll be attending to anything, any human being, as long as they're sick. But if I decide to do surgery, I'll only restrict myself just on those patients that will have surgical problems. Those are the advantages of specializing, but it requires that we go back to school for other additional years. And that is the reason why, as a guy, as a medical personnel, we get to settle down when you're around 35 years to 40, because it's continuous learning like that. I hope I've answered that question from the inbox. Whoever asked that question. Okay. We move on to anatomy. So this is okay. I thought there was someone.
Question.
There's another
Also,
question. Go ahead.
So during the specializing periods, is it supposed to be more like a full-time learning, or it would be like a part-time learning?
No, learning, it will be as you are working, you are learning. For example, when I become an intern,
is there such a situation whereby?
Okay, there are 2 people talking, if I'm not mistaken. Let me answer the first. Let me answer the first question.
You do not specialize, and then you just
okay, there's someone
general.
Okay, your network is breaking, sir. We can't get.
Is that such a thing?
I couldn't get your question. I think you are breaking. I only got the first question that was asked by someone else. Okay. Okay, so yeah, like as I'm practicing medicine, I'm learning because I'm
Yeah,
perfect.
are you able to get me now?
Okay, yeah, we're able to get you. Can go ahead, sir. I'll be calling everyone Doc. So you can go ahead, Doc. Okay. Okay, so what you can do, I think your network is not really that good. You can type the question in the comment section, then Chike, you'll be able to read that question for us, and then I'll be able to answer it for him. Okay, so someone was asking how the learning will be. So when you're an intern, as you are practicing medicine, you are actually learning. There's no such a thing as like going in class and then they'll be teaching, you already did the theoretical aspect, you're just perfecting your practical aspect. So as you are attending to the patients, coming up with diagnosis, treating the patient, giving them medication and the like, you are actually learning. And then there are times where I'll be finding those tough cases where this patient has a condition and then I can't just figure out what the problem is. I mean, I'll go and consult. That's the reason why we have consultant. Okay, sir, I have this patient. They are complaining of this and this and this and this. I just can't get the problem. I don't know what the problem is with the patient. Then the consultant will be there. Okay, I think the patient has this and this. So that is the type of learning that gets to happen during internship. It's not the learning where you get to sit in class. No, you're actually practicing. Where you're not sure, you consult. And that is why you have to do your internship under supervision. By the way, they now introduce exams. So it means when you're done with your 60th, before you are given your license, you have to write your exams and compete with the rest of the guys within Zambia for you to be given. It's like Kiziali, the way law was, right? For someone to practice law, they have to be given a license. So that's how it is now, starting next year. Okay. So let me go straight to the courses. So I'll start with anatomy. Okay, so very important. Yes, Doc.
Before you go, there were some questions that were posted in the chat. Let me just read. There are about two. The first one says, do you get paid when you specialize?
Do you
And
get
no, do you get
paid?
Yes, when specializing.
Oh, when you are specializing. Okay, so what happens is once you are done with your internship, so when you the only university that offers specializations is UNZA. So anyone who did let's assume someone did their medicine at CBU or Apex, they will still come back at UNZA because UNZA is the only university so far that offers those specializations. So what happens is when you apply for specialization, you as a doctor will be transferred to UTH and you'll be working at UTH. So the way specialization is, you're working and learning, but advancing, working and learning for the next 5 years. So you'll be, in fact, your salary actually raises up a bit. So a general doctor is that doctor who would finish their internship. They're called general doctor because they can attend to any patient, but their knowledge is shallow, is broad. Cannot compare it with a specialized doctor. So their salary is a bit lower. When you are trying to specialize, even the Kamasari sort of like increases maybe from 21, maybe to 24, somewhere there, as you'll be at UTH. So you'll actually be getting paid and you'll be working. So it's easy for you to actually pay for yourself and the like. I think I've answered that question.
Yes, and the next one is reading. How long does it take for it to specialize in OBS and GYN?
OBS and GYN is 4 years. So yeah, 4 years. 1, 2, 3, 4. And any person who is specializing is called a registrar. So if you are in year 1 surgery, you'll be registrar 1. You call them PG1, PG2, PG3, PG4. Instead of med 1, med 2, med 3, med 4, we use the word PG. Okay, they're called registrars. So obstetrics and gyne is 4 years, pediatrics is 5 years, surgery depends, but general surgery is 5 years, neurosurgery is 7 years. And then you have internal medicine, which is internal medicine is I would say 4 years general, Then the last year, you now go for what you want to do, which is 5. Yeah.
Okay, and the last question reads, just a minute. For the half courses, will we start learning all of them at the beginning of the year, or we have some in the first semester and then the others in the second semester?
Okay, so like I said, at Ridgeway campus, all the courses, when they say school has started, all the courses will start at the same time, and there will be a schedule, okay, a weekly schedule where you see that biochemistry is Mondays, Tuesdays is physiology, and this course. So you'll be learning this, whether half or full courses, you'll be learning them at the same time until the end. The only course that is an exception amongst the 6 is CBE, okay? So for your seniors, the immediate seniors who are Med 2s, soon to be Med 3s, they did their CBE towards the end. It's a course you only do for a month. And when you're doing this course, you stop everything. For example, if they say CBE will be done in March, you will stop learning physiology, stop learning anatomy, everything, you just be learning CBE for that 1 month. Okay, so but for your seniors, the immediate seniors, it was put towards the end because of the fact that there were issues that this year, trying to find where they're going to learn and like, so I had to put it towards the end. And as we speak, I think this is their last week of doing CBE. They're now in the communities trying to get some data and the like. So all the courses, you'll be learning them at the same time until December. And there is no break. Once you start in February, is it March? Once you start in February, March, it's it until December. There's nothing like a break. I think I've answered all the questions. Okay, so let's dive in now into the courses you'll be doing next year. So we'll start with anatomy. Okay, I'm sure you've heard stories about anatomy. Okay, all the stories you heard about anatomy are true. Okay, the bulkiest course at year 2 now, which was our year 3. Okay, most of the time, 60%, actually for me it was more than 60%. Despite putting 60%, for me it was more than that. Most of the times when I'm reading something, it was always anatomy. Most of the time when I'm reading something, it was always anatomy. And the lecturers from anatomy department are very serious, very dedicated. So they make sure that they will be teaching you, they come for their classes, they make sure that they follow. Look at your immediate seniors. There were a lot, but anatomy department made sure that these guys wrote their practicals. The tests were physical, okay? They are serious. So this is a course that will carry, the reason why people don't study these other courses is because of this course, okay? So anatomy basically is studying the structures of the human body, the structures of the human body, okay? Now, this anatomy can be divided into 3, and that is why it is the bulkiest, okay? So it is divided into embryology. So embryology is when you start the human development, human development starts from conception all the way to birth. So whatever the events that gets to happen from conception, meaning a male and a female, they have sex, you have a sperm, it unites with the ovum, and then every event that is going to be happening all the way until the baby is born, that is what we call as embryology, okay? And then you have histology. When I came in as a 3rd year, I was confused. Histology, I used to think like it's history, okay? Then I later learned to say that in Latin, histology actually means tissue, okay? So histology is also called microscopic anatomy. Why? For you to study this type of anatomy, a microscope is a must. You always need to use a microscope for you to be able to see a tissue, okay? A tissue is a group of cells. So this is another component of anatomy. And then you have gross anatomy. So gross anatomy is also called macroscopic anatomy, okay? So macroscopic meaning structure, the things you can see with your naked eye. Things you can see without a microscope. If you're able to see them with your naked eye, that's what we call as macroscopic anatomy. So you'll be studying different organs, different structures that makes up the human body. Now, this gross anatomy is divided further into 2, okay? You have general anatomy and what we call as autopsy. General anatomy is the study of the structure and composition of the body, okay, including fluids. So under general anatomy here, by fluids, we mean, for example, circulatory system. Under general anatomy, the topics will be taught in class, meaning the lecturers will be coming to say, today we are doing anatomical positions. Today we are doing the nervous system. So these topics will actually be taught in class. I mean, the other part of gross anatomy is called autopsy. We usually call it as DR, okay? So autopsy by definition is the systematic examination of a dead person, okay? You are examining a dead person for, maybe it can be medical reason, it can be legal, it can be scientific purposes. So because for us, it's for learning purposes, it's called academic autopsy. But most of us, we call it DR, and the DR just stands for dissecting room. So it's a wrong thing. The correct thing is that it's called academic autopsy. Remember, autopsy is also called postmortem, by the way. Postmortem, so this is called academic postmortem. We can also call it autopsy, but it's called academic because we are just using those dead bodies for learning purposes, okay? The other things you learn later on in forensic. Now, this one is not taught in class, okay? This one is not taught in class. Most it's practical. You'll be going to your dissecting room, checking out the dead bodies. Now we have demonstrators. In my time, even the ones who are now going to fourth year, no, not these ones, the ones that are going to fifth year. We used to dissect by ourselves. You are given a cadaver, you'll be the 10 of you, then you'll be cutting it, learning the structures. But for you, because you are a lot, they now started hiring demonstrators where they'll be cutting things for you, and then you'll be coming to your DR in an hour. I think they'll be showing you structures, and then you'll go. So this is how you are going to learn your autopsy. It's not taught in class, that's how you'll be learning it. But there is need of you to know the theory before you know the practical. So generally, you'll be studying 4 things: embryology, histology, gross anatomy, and when autopsy starts, you also be studying autopsy. 4 things in one course. Okay. Then the recommended books. So for histology, I've highlighted the books that you need to have. They are all available for as soft copies, and we've already uploaded everything for you. So I'll share the link to the data format too right after this session. So we have Janquilla. So Janquilla is the standard book. That means if you want to study histology, this is the book to use, called Janquilla. Now, this histology, there is also a practical aspect, meaning you have to be you'll be going into the labs, you'll be checking out structures. The books to use when you are doing your practicals, these are the 2 books here, okay? Heroshenko, I like this book, and I've been emphasizing to the guys that are going into the other year to be using this book, but most of them, they never used this book, not until they now started preparing for their exam, which was bad. So I'm hoping to be you guys will be different. You start using this book. Whenever I read a topic in here, that topic can be summarized in here. And these books, they are more practical, meaning they'll be telling you to say the tissue that makes up the skin, it looks like this at this magnification. It's more of practical. So don't throw away these books, because you'll be shocked when the practicals for histology comes. There's a lot of memory. You have to memorize a lot of slides, and these books will be able to help you. But remember, Janquilla is theory. Okay, whenever I want to understand a topic, this is the book to use. Embryology. So the standard textbook for embryology is Langman, which is this book here that has been put for you. And in anatomy, they bring diagrams. Most of the diagrams that come from embryology, they are gotten from Langman. So I've always been emphasizing, at least those students that were on MMRS, most of them that were, taking note of what I was saying, they had their anatomy at ease, like it was easy for them because I used to emphasize to say, make sure you know all the diagrams in Langman, okay? Because most of the time they just replicate the very same diagrams in your test and exam. Then there is a kind of supplementary textbook that is very good for you to revise your embryology. And by the way, embryology questions are hard because they require you to understand, okay? So BRS, this is a supplementary book, meaning if you've read a topic and you've understood, you can supplement that topic using BRS. Don't start a new topic in BRS, at least for now. Maybe towards the end, as you're approaching the exams, when you don't have time. But as you are starting, read a topic from here because it's detailed, okay, to give you a lot of information. Then now you can narrow it down with the BRS embryology. Then you have another book. Remember, I said we have gross anatomy, and we said that gross anatomy is divided. Yes, Doc.
So will you kind of go back to the previous, before this one, the previous page? Yes.
Okay, getting screenshots. I hope we are done.
So we need to buy this book for what?
Do I need to?
We need to buy this book for what?
Oh, do you need to buy these books? Okay. So for me, okay, for me, I would say there's no need of you to buy these books that are here. But if you have money, you can still go ahead. But there are books I want you to have as hard copies, and I'll mention them just here in anatomy. I think the Atlas and the Chaureza, I'm yet to talk about them. There are books I want you to have them as soft copies. These are the ones you can have them as hard copies, sorry. These are the ones you can have them as soft copies because they are expensive. Like this book is around 800 to 1 pin, just a Janquila book. So buying all these books would, unless you have like a lot of money. So on these ones, no, you can have them as soft copies. Even this one, just have them as soft copies, okay? Then for gross anatomy, remember I said gross anatomy is divided into two. You have autopsy and general anatomy. So there are things you'll be learning in class. You can use this book called General Chaurezia's Handbook of General Anatomy. So it's a systematic. It's systematic, meaning it will be giving you systems like GIT system. It will be giving, and those are the things you'll be learning in class. But this is gross, okay? Then you have your autopsy. Okay, these are, if at all there's a book I would recommend to have it as a hard copy, it's Chaurezia. There's a difference between this Chaurezia and this Chaurezia. These two, they are for autopsy, okay? They are for DR, and they are divided into 4. Volume 1, you only be talking about the upper part of the body. Volume 2, you only be talking about the lower part of your body. Volume 3 is now what I'll be talking about with your immediate seniors on Wednesday. It's head and neck. Volume 4, it's the brain. So for you who is going to be a Med 2, the only books you need are Volume 1 and Volume 2. For a start, you can buy a Volume 1 because you have like 3 months or 4 just learning about Volume 1. Okay, this is a book I want you to have as a hard copy. This is a book Mukape likes, and most of the questions, it's a bulky book, but most of the questions, they usually come straight from this book. Okay, so it means, and this is a book you cannot read just to, you cannot read a topic from this book one day or once. It's a book you need to be going back over and over. Repetition is the key in medicine. You read it today, when you're bored, you read it again, and that is the reason why I want you to have it as hard copy. It's hard to use it as a soft copy, because of the fact that as a hard copy, you can easily open where you want to read and just read and like. So these are the only books I want you to have as hard copy if you want to buy a hard copy book, okay? Then there's another book called Zuckerman. This is a book, it's an instructional book, meaning it tells you on how to go about with a dissection. But again, because you won't be dissecting, the people that are reading this book mostly are your demonstrators, okay, and also interns like me. So the demonstrators are the ones that usually read this book on your behalf. They dissect the cadaver, and then you guys, when you come in, You just be looking at the structures. So it's okay to go peruse through. It's there in hard copy as well. It's okay to peruse through what you'll be doing in that particular week. But if you want to pass these books, even if you don't study this book, Charles Zuckerman, as long as you stick to your Chareza, you are good. Okay. Then you have your atlases. You can see anatomy, how bulk anatomy. We're still talking about anatomy. I don't know, it's been 30 minutes now. Still talking about anatomy. Atlases, okay? Remember anatomy, you cannot study anatomy without diagrams. You cannot study anatomy with just notes. There is need of you to have atlases. When I was talking about histology, I mentioned to say histology has atlases as well, which are Eroshenko and this other one here, atlas of histology, this other one on the far right, okay? These are the atlases for histology. Now, the atlases for autopsy or gross anatomy are these two. You can choose either Frank Netter's or Gray's Anatomy, okay? Frank Netter's is also good. If you want to buy, and I am encouraging each and every one of you to buy an atlas, buy Frank Netter's, and then have Gray's Anatomy as a soft copy. So the only books I want you to buy, if at all you want to buy textbooks, Chaoresia, at least have it as a hard copy, and have an atlas, Frank Netter's, because you'll be going through a lot of diagrams trying to memorize structures, because they do come in your test and the exam. It's easier when you have a hard copy than a phone or a PC. Okay, for example, you'll be coming to Ridgeway campus every time you want to do your DR. If you have those books, you can be revising as you are heading to Ridgeway campus within the school bus. So it's very important you buy these books. And most importantly, this one you can have it as a soft copy. Gray's Anatomy flashcards. Most of the diagrams that gets to come in your exam, if not exact, at least they'll be almost similar to what is in this Kama text, the Kama flashcards. So this is a Kama book, a must-have book, and you don't need to buy it. You don't need to get it as a hard copy. It's already there as a soft copy. It will be used for revision when you start your DR, when you check for, like trying to test your mind, labeling the diagrams and the like. Okay, so these are other tips and the study pointers. I know most of the students don't take practical serious, like in physiology, biochemistry. It's not bad, okay? Practicals in physiology are not really bad. Practicals in biochemistry are not really bad. But practicals in your anatomy are very important, guys, because you'll be examining patients. And for you to examine a patient, you need to know the anatomy. You need to know that on this particular part of the body, what is found is this. It's okay if you just gun your practicals in physiology. I'm talking about practicals. They are not really that important. But your DR anatomy, your autopsy is very important, because you're going to meet up patients. Patients are what we get to study in anatomy. So this part you should pay attention, okay? You should be interacting with your lecturers and especially the tutors, the demonstrators, okay? If you make a good rapport with them, they'll be there to help you out as you do your DR, okay? And then most of the people, they get to worry about cadavers. Don't worry about cadavers. You know, those people are dead. You shouldn't worry much about them. Yeah, you'll get used with that. In terms of lecturers, in fact, it's supposed to be 9 here. Anatomy appears 3 times every week, Monday, Wednesday, and Friday. So it's supposed to be lectures 9 hours. Practicals, you'll be almost the entire week, you just be doing anatomy practicals. When you come to Ridgeway campus, you come around 10, you're heading back to main campus around 15, okay? So practicals will just be, it can even be more than 6 hours, but you'll be doing a lot of practicals in anatomy when you start. Okay, continuous assessment. So in anatomy, continuous assessment is 40%. Okay, in that 40%, you have written tests, practical, vivas, and labs. Okay, so for your written tests, they usually carry 15%. Okay. Practical test includes your DR, meaning when you dissect, they'll give you an exam for those things. your histology practical aspect, you'll be going into the labs. When you do those histology practicals, you'll be given a practical histology. Okay, so those tests, they carry 10%. In our time, we had vivas, but because you guys are a lot, they can't manage to. Vivas are oral exams or oral tests. They're only for about 3 or 4 lecturers in anatomy department. They can't manage to viva 3,000 students. So this year it wasn't there, but last year it was there because there were only a few students. I'm told the med ones are now 280. So it means vivas next year, after next year, when they become med twos, it might come back because they're just few students. Okay, so these are the assessments. All these make up 40%. Now remember, this is a fixed thing, but it depends with the performance. If a lot of students get to fail written tests and then most of them passed practical tests, it means it can change. Practical tests, they can become 15 or 20, and then written tests, they can give it a 5 or 10, because that's how they moderate. They don't give free marks. Moderation is look at where the students did well, then give a lot of marks on that particular area. That's how they get to moderate. There's no such a thing as giving free marks at Ridgeway campus. Final exam is 60. Okay, so 60% is the final. So that 60 has the written paper, which is 25%. Practical, again, the very same practicals you are doing, you are going to have an exam. Your friends, they made 2s and they made 3, actually had theirs on a Sunday, if I'm not mistaken, on Saturday. Okay, and then like I said, vivas are usually done when the students are few. So in your case, probably you won't have vivas, but it will come back for your juniors who are now becoming med ones, because about 280 of them. Okay, so that's how the format is with anatomy. Do you have any questions before I move on to the next one? Physiology. Sorry, it's a bit lengthy, but I hope it's helping out. Any questions concerning anatomy? I hope I've exhausted everything you wanted to know or needed to know.
Sorry, Doc, there's a question in the comments.
Yes, go ahead.
Okay. In the place of vivas, if we don't have them, because we're a lot, where would the other 10% go?
Yeah, it will be distributed most of the time. Remember, look at, for example, final examination. It's saying 60%, 25 written paper, practical 25. So it means if your immediate seniors, they never had. So it will be 5% to the practical, 5% to the written paper, 30%. So 30 written paper, practical 30. And then for the continuous assessment, that viva, that 10%, 5% goes to the written test, which will be 20, practical test will be 15. Labs at Ridgeway campus are always 5% because people crook, okay? And like at main campus, labs are given 15. Here, labs are always 5%. Because people just crook around and so they don't believe in giving a lot of marks where labs are concerned.
Okay, the last question reads, what are the 3 last books you talked about specifically? Is it gross or histology? Sorry for taking you back.
The 3 last books, I talked about this one, Gray's Anatomy flashcards. So I said this one, once I share a link in the group, which you should check around these books, okay? We've already uploaded them. Gray's Anatomy flashcards is a book that there will be diagrams, and then they're telling you label this, label this, label that. So it's good for practice when you've studied, and everyone should have this. Don't wait, guys, until the last moment and for you to start going through that. Start now, at least enjoy your festive season. Start next year, January, immediately. Yeah, for those that are very sure that you've cleared, you can start. Those that are not unsure, wait for your results and but immediately you know that you've cleared and you're heading here, you should start studying, okay? And you've been guided accordingly. These other ones are atlases. So atlases, they only have diagrams. They have a diagram. They can have a diagram, for example, for a breast. Then they'll be telling you this is a nipple, this is a what. So they are used for memorizing structures, because for you to understand, you have to start with memorizing. So these are just atlases for structures, gross anatomy. Okay, I hope I've answered. Those are the last books I think I talked about. Unless I hope I've answered the question. Okay, can I move on to physiology?
Okay, sorry, there are just two last questions. The first one reads, what's the difference between labs and practicals?
Labs and practicals. Labs and, okay, so practicals, remember labs is specific. Things you'll be doing in a lab, okay? Things you'll be doing in the lab. For histology is something you'll be doing in a lab. You have a microscope, you have slides, and then you'll be checking them. You'll be checking how the cells look like, and you'll be drawing and labeling. DR, dissecting room, is not really a laboratory thing. You can consider it to be a lab, but it's not really a lab, okay? So now a combination of DR and what you get to do in the labs under histology is what we are calling as practicals. I hope it has made sense.
And the last question reads, when do practicals or for DR start?
Yeah, your immediate seniors, they started very late. They started somewhere in July, heading to, and they never finished. But yeah, it's not like they'll go back to those things. So it's up to them to find time to actually go through those things, because if they don't, it will still catch up to them, either at year 4, year 5, year 6. So it depends, okay? Usually it depends with how fast they will be in terms of securing dead bodies, those their cadavers. If they do it very fast, then you might start maybe within 2 months after learning, 2 to 3 months after learning. So they have to look for those cadavers, look how many, they have to first see how many people are going to register, and then look for the cadavers for you guys. So because you are a lot of you, it might take a longer time than usual, but remember that it would disadvantage you, because they'll make sure that they cover as much as they possibly can before the exams. So on MMRs, we'll try by all means to start the DR theory part as soon as possible, so that when you're starting those practicals, you know exactly what you're doing. I hope I've answered the question. Siluye, Michael, you have your hand raised up.
Yeah, I also have a question.
Okay.
Yes, yeah, some people are saying that like for anatomy, when studying, you have to finish a topic every day. Like when you have a lecture, you have to finish a topic. Now you find that some topics, they are very long. So is it possible to study a topic in a day?
Okay. Yeah, so that's how it is. Even in class. If take here, I said lectures, you'll be having them 9 hours per week. So Monday. Oh, actually, this is correct. 6 hours, 2 hours. I was correct. So 2 hours on Monday. You guys are used with the 50 minutes classes at main campus. Kunoma classes, they are 2 hours. 2 hours Monday, 2 hours on Wednesday, 2 hours on Friday. And each of those 2-hour session, you'll be doing a topic. So meaning, for example, if you are going to start anatomy next week, you would have already covered the 3 topics in class. And now you have 3 topics to study. It means you have to cover those 3 topics in that 1 week. If you are not going to finish those 3 topics, next week you're covering another 3. And that's how it's, once you are left behind, you will never catch up with anatomy. Because in 2 weeks, you would have already covered 6 topics. And remember, these topics are covered in 2 hours, and that's a lot. And that is the reason why on MMRs, we're trying to start the classes immediately after festive season, so that if we can cover, like what we did this year, we covered almost all the topics, and the students, all they were doing was just going back to the recorded sessions, because we were very much ahead of class. And students had ideas of all the topics that were taught in class. That is the only way we saw that it can be possible for a student to, sort of like catch up, or at least be almost closer to what is being taught in class. Otherwise, it's not possible, especially if you are doing these things for the first time. There's first time reading, there's the second time reading as well, repetition. So With time, you get to learn the technique. But as you are starting, it's hard for you to read one topic for a day. You might need 1 or 2 weeks to actually understand that topic. But with time, a fifth year student can study 5 topics in 2 hours because they understood a technique. And as you head towards the end, you get to develop that technique as well. I hope I've answered your question.
All right, thank you.
You're welcome. All right,
Doc.
yes, Doc. One last question.
I also have a question.
But your network is bad,
Go
Doc. It's lagging. It's lagging.
Okay, I can just type then.
Okay, yeah, now clear. You can go ahead. I think it's now clear.
Yes, I was asking concerning anatomy. We know to say we have 3 components: embryology, histology, as well as gross anatomy. So like in terms of studying, so do we have to study like embryology on its own separate, then histology and gross anatomy, just like that?
Yes, that's how you will be. Even teaching on MMRIs, even in class. Mondays are usually for gross, if I'm not mistaken. Tuesdays are for histology, and Wednesdays are for histology, and Fridays are for embryology. In class, they will be taught separately, but the timetable for anatomy will just come as one. Then you have embryology topics, gross anatomy topics, and histology topics. On MMRIs, we teach them separately as well. There are sessions for gross anatomy, sessions for embryology, and sessions for histology. So even studying, you'll be studying them separate. So you can consider them as separate topics, separate courses, sorry. But towards the end, you're writing one exam, which is anatomy, which will have embryology, histology, and gross.
Thank you very much.
Okay.
Doc.
Yes, Doc. Is this video being recorded, guys?
Yes, it is.
Oh, it is being, you can see the camera recording per corner.
Yes, I can.
Okay, all right. Go ahead, Doc.
There's a question that reads, are we going to be learning on Saturdays and Sundays?
Yes, you will be learning on Saturdays, and I had a lot of sessions, makeup sessions with our immediate seniors, the Mmrs 2s, because by then I was a student, we were students, so the only time we would have classes with them were Saturdays. And the class reps were very good, and they used to come up with makeup sessions for us so that we can catch up on Saturday and Sunday. So to answer your question, yes, especially anatomy with Dr. Mukape, Dr. Mutemwa. You'll be having a lot of sessions on Saturday and Sunday. There's no such a thing as I'm an SDA and I don't go to, it's up to you really. They won't care about you being an SDA. They won't care about you being a Jehovah's Witness. If they say Saturday we're having a test, if you decide not to attend that test, then that's your own thing. But classes, makeup classes, especially Saturday and Sundays, yes, will be around. And we had makeup classes for behavioral sciences. Your immediate seniors were behind. So they had a lot of makeup classes up on my weekends. And it will happen to you as well because your results are coming out on the 20th of January. And then you are going to start school probably in March, somewhere there. So, and if we start on MMI somewhere in January, we would have covered the entire term 1 for your test 1 by the time you guys are starting your classes in classes, in UNZA classes. We are good. I can go ahead. I think I think that's the last question. Let me proceed. We might spend 5 hours in the whole thing. So let me move on to physiology. Okay. Now I need to emphasize to say, by the end of the year, most of the people who pass anatomy, and most of the people who pass anatomy than physiology. And this is one reason. One, most of the people, they'll be spending most of their time studying anatomy, which is true, okay? And 2, anatomy has there are a lot of ways you can compensate. You can fail a written test. It's not the end. There are practicals. You can fail that practical. It's not like you have a lot of areas where you can get marks. That's the point. And overall, even when the results come out next year for your immediate seniors, You realize that when the list comes out for those that will be the unfortunate ones, most of them will pass anatomy and a lot might fail physiology. This is the reason why. Physiology requires that you understand. Anatomy is mostly memorization. Physiology is about understanding. You have to use your brain. Why is this like that? Okay. Most of the time as you are studying physiology, you get to ask yourself a question, why, and why? And you should find an explanation to why things are like that. And that is physiology. Remember, in anatomy, you are studying structures. Physiology, you are studying the very same structures you learned in your anatomy. Now you want to understand the functions of those structures. For example, in anatomy, they will teach you about the heart. The heart looks like this. These are the parts. Physiology will tell you how the heart works. For the heart to pump blood, it does this, it does that, and it does that. So physiology, there's need of you to understand. Now, because there's need of you to understand, it means you need to be spending more on books, and there's more of reading and practicing questions. Okay. Physiology is known to be a killer course because of the MCQs. The MCQs in physiology are hard. Okay. And most of the people, what usually happens, they notice that they don't have time. They'll resort into memorizing MCQs and they'll stop studying in hoping that those MCQs can be repeated. And then in the exam, the lecturer brings new sets of MCQs. Okay. And if you've never read and understood a particular topic, there is no way you're going to guess the correct answer. As one of the tutors, I gave students in class quizzes, the MED2s especially. The students were, we tried giving out those quizzes so to prepare them for the upcoming tests. Because most of the time in university, students usually didn't have quizzes until they get to write their test one, and then they get to learn their mistakes in their test one. So I'll be like, no, let's give them quizzes, and then they learn their mistakes through quizzes, which have lower marks as compared to learning their mistakes in test ones. So we tried to bring in some quizzes here and there, and they wrote, but point is, students were not studying and they were failing those quizzes, okay? And now these very same quizzes have become in handy because the test, some of them, the tests were bad and the exam was bad. Now this quiz is needed for them to have some marks so that they can clear, okay? You get the point. So physiology is a killer course because of the fact that you need to understand and it requires time, okay? That's what I'll talk about physiology. And then the books, I'll go for the books, and these other things I think you can read. I'll share the presentation. For those that won't be on MMRs, I would recommend to use Dr. Najib. There are videos called Dr. Najib videos. There are videos called NinjaNet videos. They're all on YouTube. If you won't be with us, you can go for those videos and you'll just be watching those videos, supplementing on textbooks. Another thing, don't rely on slides with physiology. You need to read the textbook. Same with anatomy. But for anatomy, Mukape slides are very important. Despite reading any resources, always go back to Mukape's slides because the things he might put in his notes that can pop up in your test. Physiology, don't stick to the slides, the notes are usually not that detailed. Okay, so always revert back, go back to your textbook. So now what are the recommended textbooks for physiology? There are a whole lot of textbooks for where physiology is concerned. We have Ganon, we have Essentials, we have Gaiton. But the book I will recommend, the school recommends Ganon. I will recommend Essentials. Why? Because it's easy for someone to understand. It's easy for you to understand topics in Essentials. Ganon is a bit, if I get Ganon, because I'm done, I know everything, I'll be able to understand what is being talked about. But first-time student, I discourage them to use Ganon. Read a topic in Essentials. When you've understood it, peruse through Ganon. Why am I still insisting on Ganon? Because there are certain things that pop up in your MCQs that are usually copycat or coming straight from Ganon. but I don't want students to go straight into Ganon. I want you to peruse through a topic using essentials because it is easy, the English is easy, and the way the topics are put are easy. Once you've understood, go in Ganon and peruse and check if there is any new thing in that topic that wasn't put in essentials. And make sure be going through tables in Ganon. They usually reference a lot of table like tests. When they're given, when numbers are in a test, if there are numbers that gets to pop up, usually those numbers are taken from Ganon. So I want you to be using Ganon only for referencing, like checking if what you've studied in essentials has also been covered in Ganon and there's no additional data that you are not missing. And then you have Gaiton as a third year. I loved Gaiton. This book is bulky. It has all the information, essentials and Ganon combined, but it is the bulkiest. But if you like storytelling books, I would recommend Gaiton because one topic, it has like 50 pages or so, or even 100. But if you are into such books like I was, then you can go for Gaiton. Okay. So personally, I recommend essentials, but we are different. Dr. Mick Mwila, Dr. Kanyumbu, those guys, their brains were tough, where they are going straight into Ganon. But for me, my brain wasn't that tough. Like it was hard for me to understand Ganon, and a lot of students, usually it's hard for them to understand Ganon. So we were using essentials. So I recommend essentials. Then you have supplementary textbooks. Constanzo Physiology is good when you're starting. It explains well those first topics like fluids, compartment, and the like. So Constanzo, you can read essentials. You check that very same topic in Constanzo and check it around in Ganon just to make sure you don't have anything. But Constanzo is bad when you start systemic physiology. Physiology is divided into 3, but we'll talk about it when you start learning. Okay, then you have your BRIs. It's a supplementary book. When you read a topic, you can now go in BRIs just to supplement because it gives you facts. Okay, so you can now use it just for revision. And then you have these books that are used for revision. Like most of the time, some of the questions are actually taken from these textbooks. A pre-test and these come MCQ, EMQs. So some of the questions are taken from these books. Not all of them, some of them, they do pop up. So instead of waiting for the test, read the topic. Let's say, for example, we've learned about cells. You've read that topic in essentials, probably the MMR notes. MMR notes are usually enough, and most of the students don't even read they don't even go to these books. But once you read, try to go through questions. Go on that section where it's written cells and try to see if you're able to answer questions. And it has answers, so you can check if whatever you're solving is correct or not. That's how it should be going. So all these are just used for revisions. In terms of learning, physiology appears twice per week, Tuesdays and Thursdays. Okay. The details about lectures and the like, part of the department myself. Dr. Kanyumba is part of the department, and then you have the course coordinator and the like. So those this is out of Vunza, but when I come in as Unza thingy, I'll be able to explain the details and what you expect in physiology. And when we start classes on MMRS, I'll talk about the physiology in detail as a course itself. Practicals, you'll find us. You'll find me, you'll find Dr. Kanyumbu, and we'll be the ones doing these practicals. And hopefully you guys will pay attention to them. We have students right now, they never submitted labs. It's really bad. But there's nothing I can do. Exams are done, so they are just getting zeros like that. So pay attention to the practicals. If you're given practicals in physiology are easy. You can copy paste and like just make sure it's not obvious for us to notice. But you shouldn't stress where practicals are concerned with physiology. And then your assessments, physiology, 40% tests, carries 30, and then the labs and the quizzes and the assignments you'll be given will carry 10%, okay? Now, This is where I said you can fail physiology. Once you fail test 1, chances of you getting an A is automatically eliminated. A and A plus, they're automatically eliminated. The highest mark you can get if you failed your test 1 is a B plus. If you fail your test 2, automatically you cannot get a B plus. So you'll now be hoping to get a C. If you now fail test 1 and test 2, plus the quizzes and the labs, then we will just be hoping for a supplementary exam. Unlike anatomy, where there are a lot of areas you can actually get some marks. In physiology, these are the only things. So you have to put in effort from the word go. And then now for the final exam, because of the fact that you are a lot, like these guys were a lot, they only wrote 1 paper. Ideally speaking, there are 2 papers. Paper 1, which is for MCQs, paper 2, which is for scenarios and the essays. Okay. So in a case where in a case of these guys where they wrote 1 paper, it was 60%. It's either you fail or pass. There's nothing I have another paper where I can rob some marks. You see why people end up failing physiology than anatomy, because of the fact that anatomy has a lot of areas you can actually get marks. In physiology, one exam, you fail, then that's it. So that is the reason why physiology is a killer course. And you will see when the results come out to say that a lot of people most likely might not do well in physiology. And then most of them might actually pass anatomy, because anatomy, they will moderate based on what those things the students were doing. I'll quickly move on to biochemistry. You now know biochemistry is a full course because it's ending with a 0, and it also falls under our the physiological department. Okay. So, like your immediate senior says, there are a lot of pathways. There is a lot of memorizing of reactions in biochemistry. Okay, so I won't spend much time about it, but because it's a full course, most of your immediate seniors will be repeating this course because they neglected it. And then now the exam came. Now this is the tricky part. They were writing test 1 online. They were writing test 2 online. And because you are writing it online, people are not studying. People have good CAs because they are writing with a friend. Some of them, they were even hiring the senior student to write for them. Okay, they got their good grades, like maybe 30 out of 40 CA. The exam came, which was physical. First of all, it not only had MCQs, it had essays, short notes. And your short notes can only be answered if you were studying. And the things you get to study when you're studying your academic year are the things you're going to remember in your exam, not the things you're going to gun towards the end. It's really hard towards the end. So pay attention to this particular course. It's now a full course for you guys. Okay. In case of a textbook, so the notes will be given by Shari Babu. Shari Babu is the lecturer for this. There are a lot of lectures, but Shari Babu is the course coordinator. The notes are usually sufficient, and then sufficient for the course, and plus the ones we have on Mmrs. But in a case where you want to use a textbook, then we have this textbook called Principles, Reninja, Principles of Biochemistry. If at all there is need of you to use a textbook. Otherwise, the slides from Shari Babu and the slides that we get to give on Mmrs for those that will be with us are usually enough. Okay. Plus the YouTube videos for those that won't be with us. You can go for YouTube videos and you can watch the YouTube videos. Continuous assessment, just like physiology. Okay. Written tests, or except we don't have quizzes here. Written test is 35, labs is 5%. Final exam 60. 1 paper which has MCQs and short notes, just like how your friends wrote it. Okay. Teaching, their friends are having it once per week. Okay, once per week, and then the practical once every week as well. Okay, any questions? I'll allow 2 questions before I proceed to microbiology and immunology. Yeah, it's a very long thing, but we just have to finish. We're only remaining with 2 and then we'll be done. Any questions so far? Shike, do we have any questions in the comment section?
No, we don't have any.
Okay, so let's move on to microbiology and immunology. So this is a half course, like I said, because it's ending with a 5. Okay, this is a simple course, really. as long as you are attending the lectures and you are studying. I know there will be anatomy and there will be physiology that will take up most of your time, but find time to read around in microbiology and immunology as well. So it's called immunology, microbiology and immunology, but the larger component of this course is actually immunology. You will start with immunology by Madam Mara, then later on microbiology with Mr. Mumbula Mulowa. Okay. It's not really bad as long as you are reading their notes. There are also MMRS notes. A book is not really necessary in this course, really. Like, just stick to the slides and the notes. You are all good, okay? Lectures, you have 2 per week. Ideally speaking, you should have 2 sessions every week, and plus the practical. Continuous assessment, all the tests you are going to write. So the first test is for immunology. The second test will be for microbiology. So total, they should carry 35%. The labs is 5. Final exam, ideally, you should have MCQs and short notes. For your immediate seniors, they only wrote an exam with MCQs only, but this is the standard format for this paper, MCQs and short notes. Behavioral sciences. So this is also what they call as psychology. Students call this psychology, but the standard name is behavioral sciences, and that is a half course. Okay, very easy as well. Stick to the notes, the class notes. Okay, there are recommended textbooks, but if we start teaching, Tutor Chimuka is the one who teaches behavioral sciences. If you start this course, you recommend you some books that were recommended by Mrs. Incheka, but you will survive with just notes. Okay, if you don't really need a textbook. So you only have one session every week, very chilled course, but when it comes to exam, you can actually repeat it if you are not studying it. Okay, so continuous assessment, most of the time you get to write one test, and that one test will carry 40%. Like my case, when I was a third year, I only wrote one test and it carried 40%. And it's because Chimuka was part of my group discussion. He loved behavioral sciences. We were there going through the Kamapas paper with him. He taught us a lot of things. We wrote what Kama paper, she repeated everything. We had our CAs like 35 out of 40, and it was good for us. Final exam, 60%. And ideally speaking, you should have essays and MCQs, but for your immediate seniors, it only had the MCQs because of the numbers. Marking is a bit cumbersome. Organic chemistry. Okay, I think it was talked about a bit by Sarah, if I'm not mistaken. So organic chemistry is a particular branch of chemistry that deals with chemical reactions, okay, that mainly involves elements, carbon, hydrogen, and oxygen. So it's a branch of chemistry that only talks about organic compounds that comprises of carbon, hydrogen, and oxygen. So in terms of organic chemistry, I gave you an example of what you're going to be looking at. There will be a lot of reactions similar to what you're able to see on the screen right now. So for you to understand what to come out, the results, you need to understand the structure, okay, the name of this molecule, how their principle, in science, there are principles, okay? For this molecule to react with this molecule, there are principles that gets to guide you. So there are rules that you need to know where organic chemistry is. So there will be a lot of reaction that you'll be memorizing. Remember, you have your biochemistry with similar structures, but biochemistry, they don't really concentrate on the structures. They just want you to know the results, like when these react, what will be the result. But for this one, they want you to know how it comes about, okay? And because of that, organic chemistry is a bit tough, and the unfortunate ones will probably be repeating organic chemistry this next year. So be sure, guys, that you pay attention to organic chemistry. Most importantly is going through tutorial sheets. We don't have those things at the Ridgeway campus, but they will be providing tutorial sheets at main campus via chemistry department. So be sure to be going through your tutorial sheets. Very, very, very important. Okay. In terms of studying tips and pointers, like I said, solve as many tutorial sheets as you possibly can. Some of the questions are just repeated from the tutorial sheets. Okay. Class notes, I wouldn't say, okay, it's a 50-50, you know. Sometimes class notes are not sufficient for you to understand certain concepts, so you might need to use a textbook. If at all there is need of you to use a textbook, Solomon's is there. There is Wade and Wade. There is also Johnson McMurray, okay? Johnson McMurray is very good because it's thorough, like it will show you step by step how the reactions, take place, okay? And then make sure, and this is applicable to all the courses, the key in medicine is to make sure that your CA is strong. You don't know what is going to happen in an exam. For example, as a 7th year, my CA in pediatrics was 30 or 29, sorry, 29. My CA in obstetrics and gyne was 28. So when I was writing my exam, the exams were tough. Right now, everyone is scared. I think this week the result should be out for Med 4s to Med 7s. Everyone is scared. There are rumors that people have failed. There are rumors that people have failed. And by the way, it's true. There are rumors that people have failed from year 4 to year 7. In our class, there's some people that have failed. That will be rotating. I hope it's not me. Hopefully it's not me. At the year 6, there are some people that have failed. Year 5, the worst intake that have failed so far out of year 4 to year 7 is the Med 4s. A lot of them, there are rumors going around to say that Med 4s have failed. Year 4 is the toughest, and a lot of people have failed. Okay, you might think like your Med 2 is bad, but Med 3, which is the Med 4, is tougher than Med. So people have failed. So my point here is you don't know how exam is going to be. So CA, good CA is the key in all the courses, not only organic chemistry, but even anatomy, physiology, biochemistry. So it means you have to be studying from the word go. You have to be serious. Not that, no, school started this week, I'll have to relax first for 2 weeks and then I'll start studying week 3. That is it. You already have a SAP if you have such a mind. Okay. In terms of teaching, 2 hours per week session plus practicals. Then the continuous assessment is 25%. Now remember, organic chemistry is at main campus. You know what main campus does? Labs are given more marks. So labs for organic chemistry, they carry 15%. So you have to put in a lot of effort as you'll be doing those labs. You can see they have a lot of marks. Unlike the ones at main Ridgeway campus where they are given just 5 marks. Okay. Final exam, only 1 paper with all those reactions you need to memorize. Okay. Other tips and pointers, I think this was talked about by our doctors and your immediate seniors, finding a study group, okay, finding time for yourself. I think these things were already emphasized by your immediate seniors, okay. This was, okay, I don't know how they made 2s, these made 3s, your immediate seniors. I don't know if they will remain at main campus, but if they remain at main campus, do not be intimidated by them. There's this thing of seniors trying to intimidate the juniors, okay? I don't know where it came from, but I found it like that. Do not be intimidated. Even when you come here for your DR, you'll be meeting up seniors that will be, they will be trying to poke you around, like show you that they're seniors, they know it all. I don't like such seniors, but wherever you find them, just give them respect and just move about with your life. Don't do anything. Immediately you react, they might report you to the disciplinary committee to say at why or something. And like, so those are the tips and pointers. Otherwise, if we graduated and made it like that, guys, it means you also can do it. Okay. Medicine is hard, but it's doable. You can see this is a picture from these are my classmates, former classmates. We graduated first time, we are graduating second time. We did it. And if you can, you guys can as well. So just a brief intro to MMRS. So MMRS is a tuition center. And just taking you through, the person who's been talking throughout is the person you're able to see on your screen. Dr. Zulu Frank, and I've noticed that these other tuition centers, they also have Frank. And students have been getting disturbed. This is the Dr. Frank Zulu. These other francs are still students. I'm not a student, okay? So those other francs you've been hearing around in other tuition centers are still students. Some of them are 4th year, some of them are 6th years. I teach physiology on MMRS, anatomy, and immunology. So for those of you who will be taking these courses on MMRS, you'll find me. On Unza side, I teach physiology as a tutor, okay? Then this was Dr. Kanyumbo Emmanuel, the one who had a chat with you for the other session. I think the second person who came in, this was him speaking that time. So this guy teaches physiology and anatomy on MMRS, but he's as well a tutor on Atunza physiology. Okay. And then this was Dr. Mwila Mick. She will be teaching microbiology on MMRS. All these were my classmates. All these are now doctors. This is Shimuka. This is the person who has been, telling us to conducting this whole thing, telling the people to come in and the like. So this is the MMRS technical advisor. He's a 60th year. He's heading into 7th year. Okay. Then you have Dr. Shimuka Simonga. Unfortunately, he's not. He's not here. I think he's busy. He's ever busy. He's our former Unzasu Ridgeway campus president. He will be teaching biochemistry on MMRS. So he will be teaching biochemistry for those that will be on MMRS. And he will be teaching probably pharmacology with the 4th years. And then we have other fellow students that have come in on MMRS that will be teaching organic chemistry. So this is your immediate senior. His name is Wilson Chamakamba. I think he was supposed to come in, he didn't. I don't know what he was doing. So this guy has been on MMRS and he's been doing really well. And he will be helping out with organic chemistry for those that will be taking organic chemistry. This is another MMRS student. So this is a Med 2 going into Med 3. This was a Med 3 going into Med 4. Remember, she's using an old curriculum. He's using a new curriculum, but both are learning the same thing at the same time. So even when I'm teaching, I teach both intakes at the same time like that. So she is as well going to be teaching organic chemistry. So these are the two guys that promised to say that they will, next year's MMI student in organic chemistry, they will have A's. So if that doesn't happen, you can easily go back to these two guys, okay? They promise to say that you guys will have A's, those that will be doing organic chemistry on MMRS. So that is really the guys you'll be seeing around. These are the guys you'll be seeing around on MMRS if at all you decide to be with us. I think I'll allow questions and then I will close the meeting. Any questions so far before we close it up?
Okay, sorry, there is a question in the comment section.
Okay.
It reads, how will the learning setup be? Will it be the same as it was in first year where we're put in groups and TGs, or maybe it will be different?
Okay, so learning usually, that's where the bad part comes in. You'll be learning as one-ish. So for anatomy and these other courses, learning was at the same time. All the 1,000 students were in a lecture room that can accommodate 400 students. So some people were sitting down and it was bad. It was really bad for the Med 2s. That's how it will be even next year for you guys. But for physiology, it was split into two to maximize the learning. So we had split the groups into two groups. There were two, I think. Two groups. Others, half of the class had a session with a different person. The other group had a session with a different person. But that was only under physiology, us. But for these other sessions, they were teaching it like that. For 1,000 students in a lecture theater that accommodates about 400 students. So it will be one like that. It won't be like the way it was done at main campus. Any other question? We are good? It's been a long session. Yes, Doc.
My question is outside from studies. It's all about because we need to be prepared with maybe our dress code and maybe how the hairstyle stuff so that we can't waste money on making our hairstyle, finding that it's not necessary.
Okay, so dress code is smart dressing, guys. Okay, I can give an example of him because you've seen the way Dr. Chimuka is dressing right now. Except you don't need a tie. Okay, just putting on a shirt, a smart shirt with a normal trousers, closed shoes. That is the recommended dressing. Okay. Of course, when you become a clinical student, you'll be now required to be dressing with neckties, like the way Dr. Chimuka is dressed. For the females, I'll give an example of her, although she has a lab coat. If you were to remove a lab coat, you can say she's smartly dressed with a kamashit and the like. That is the standard dressing at Reach. For the third year, for the med twos, anatomy department does not tolerate these other types of dressing. And if you have noticed that your dressing is not good, you can be failed at that's the thing with medicine. Some people have been failing not because they haven't been studying, because maybe they had dreads. They've been told to go and cut them out, they don't. Then they will be failed. They come back, they are failed. I had a student, his surname was Zulu. I've forgotten his first name, but he was Zulu as well, like myself. He had dreads at year 4. He was failed and failed. We left him. He kept on failing and kept on failing because of the very same dreadlocks. And what did he do? He decided to quit because there's nothing he could do. So make sure that you dress appropriately, and dressing appropriate doesn't mean you need to have a tie. It can be a Kama t-shirt with a trousers, closed shoes, not coming in class with a matropico. Some of the students were coming in class with flippers. Okay, so that is the standard dressing. And of course, you need a lab coat, right? You need a lab coat for your whenever you're going for your labs and your DR, you need to put on those lab coats. So a lab coat plus no more dressing, that is all you need. When you become a clinical student, there is more, but it will be talked about 2 years or 3 years from now, how you dress when you're a 5th year or a 6th year. Any other question?
There's a question in the it reads, my question is far from what has been spoken. How much is each course and when are lessons likely to start?
Oh, yeah. So because it's 100 kwacha. So it's 100 kwacha per course per month. Like some people just decide to say, no, I'll just do physiology and anatomy. So it means anatomy 100 kwacha, physiology 100 kwacha per month. And then we posted the schedule in class. The whole of January will be free. And I would advise each and every one of you to maximize these tuitions. Join whatever groups that are available, attend all classes from all different tuition centers, and then come up with a conclusion by January and stick to one tuition center. Don't be here and you are there. Okay. If you decide to stick to another tuition center because you feel like those are very good, stick to that because you are benefiting from there. Don't be moving up and down from tuition by tuition because you get confused. The way I get to teach my students, I teach them systematically in such a way that I'll be referencing to previous topics. Now imagine you are not here, you are the different tutor, you get confused when you come here. So maximize. I'm aware that there are a lot of tuition centers and they're doing free sessions. Attend all of them and see which one would work well for you. But attend the free session. So we'll have free sessions in January. The whole of January will just be teaching for free, so that by the end of January, you decide to say, is it going to help me or not? And then February, that is when the payments will start, and then it will be 100 kwacha per course per month. Any other question?
I'm just checking the chat box to see if I left out any. I'll let you know.
Okay. What about those that have questions and they can speak, they can unmute themselves and talk?
There's a question in the chat box.
Yes.
It reads, what are some of the requirements needed in Med 2?
Requirements. What do you need in Med? The only things you need as a Med 2 really, the books, the soft copy books. So we've already uploaded the data for you. I'll share the link in the group right after the session. And then when it comes to, I've also mentioned the books you need to buy as hard copies, right? I just mentioned to the entire presentation, I mentioned two, Chauresia and the Atlas. The rest can be in soft copy. And then when it comes to other things, buy a lab coat. That's all you need. For organic chemists, you also need to buy those goggles protecting your eyes and the like. I think those are the only things you need. It's not, you don't really need anything. For the guys that are going into year 3, year 4, there is need of them to buy additional materials. They need to buy some stethoscope, they'll need to buy, but don't buy a stethoscope. You'll be using it for what? Don't buy a stethoscope or anything or any other material that is used by doctors. They made 3s, they made 4s, they'll be doing clinical skills. And I said clinical skills is a course that will be mimicking what happens at the wards. So there's need of them to have those materials because they'll be practicing. But for you, you just need a lab coat. That's all.
Doc, there's another question. Oh, Doc,
Yeah.
you forgot to mention the gloves as well. Sorry, you forgot to mention the gloves.
Oh, the gloves. Okay, yeah, plus the gloves for DR if you want to touch the. I'll go to use touching those cadavers using my hand, and I'll be eating popcorns in the DR. Anyway, yes, plus the gloves as well. Don't be a vampire like me. Okay. What was there another question?
Yes. You mentioned a couple of books that we're supposed to buy. So what's the price range and what bookstores do you recommend that we buy from, or do you know anyone personally who can be a supplier for the said books?
Okay, so Dhruv Daj, I don't know if he's still doing that. Dhruv Daj, we know Dhruv, right? Dhruv is famous. He was my former classmate, the Chaji from our class. He was always the highest in our class. And even when the results come out, probably be the highest. That guy used to order books. I don't know if he's still doing it, but if he's still doing that, I'll post in the groups to say that Dhruv is still going about the books, and I can give you his line so that you can communicate. So what he does is you have to order, and then he has to order from India, and then you guys will get them. I don't know if for a week, 2 weeks or 3 weeks, then you guys will get them. But other than Dhruv, I don't know if you have those books at main campus, but at Ridgeway campus, because it's a medical thingy, there is a book world. So those books are usually there, even more book world. But those are expensive. So you can even buy from your seniors. So when you're buying from your seniors, it will be like 400, 300. But if you're buying brand new ones, it will be like 800, 900. And I only mentioned 2 books here, guys, the ones you need to have as a hard copy. I said this one, Atlas, you can choose either of the 2, but I recommended Frank. And then I said buy Chauresia. These are the only 2 books you should buy as hard copy if you have money. But I know there are people who don't have money. It's okay. You can stick around with a soft copy books, okay, if you don't have money. Those are the only books. Vivasa, I just have them as soft copies. It's okay, it's fine. You can buy a tablet and have all these books and you'll be using it for study. Better. Any other question? I will allow 3 last questions, and you call it a day. We might spend
Yes, sir. So concerning what's this anatomy, are we going to be writing the histology, growth, and embryology and what's this components as different papers?
No, I said anatomy, despite it being taught separately, the way I explained it, in biology, histology, and growth. When you are writing your paper, you'll be writing it as one paper, anatomy, and maybe the first 25 questions will be in biology. The second 25 questions can be histology. The last set of questions can be growth, or it can be a combination. But point is, all 3 components will come in either your test or your exam. They'll bring all the 3 components in that paper. Have I answered your question?
Yes, sir. Thank you so much.
Okay, that was question number 1. Question number 2, we're only remaining with 2 more questions, then we call it a day.
There was someone in the comment section that was asking that you explain about the GPA system.
Okay, that's very good. Thanks for bringing it in. Okay. Now, the GPA system, I was telling them they soon to be matrices to say, you don't need to worry about the GPA system. Why? Because your MBCHB is not graded. There's no such a thing as a doctor or with a merit, a doctor with a credit or a silent. So you guys, your degree won't be graded. Okay, even if Mupoto Muje to show that your GPA is what, it won't be graded. As long as you're moving, you're passing your C's and the like, you are okay. And at the end of the year, your MBCHB, there won't be a thing like you got a credit, you got a merit. No. Okay. So you don't need to worry about your GPA system, but if need be, I'll share a document which talks about the GPA system. So a GPA system, it calculates the total number of points from the year 1 all the way to that year you're going to graduate. Adds them and then come up with an overall point. And then it will be, that will make it possible for UNZA to grade you with a merit, a credit, or a silent. So you guys, there won't be anything like that. But for these guys who are using old curriculum like Chike, she's graduating, next year she's going into 4th year. When she's done with her 4th year, she will graduate with a human biology. You can see these doctors that have been presented here. Everyone has human biology on their thingy. Because Dr. Kanyumbo has Bachelor of Science in Human Biology, MBCHB, and he did Diploma in Teaching Methodology. I did Diploma in Teaching Methodology as well at UNZA, MBCHB, Bachelor. So we graduated twice because we were using old system. And the first graduation, the GPA was included. Okay, so our human biology were graded. Some people like Dr. Mick got merit, we got my credits, and Dhruv got a distinction. Okay, so that was human biology. But for the final MBCHB, there won't be like Frank got a merit, there won't be anything like Dhruv got a distinction. All of us will just be MBCHB. In short, no need to worry with your GPA. Your degree won't be graded. One last. Yes, one last.
It's saying, okay, let me just combine them. It's saying, does a school offer means of attaining extra credit points? And someone is asking for the directions for the library in UTH.
Directions for the library in UTH. Okay, so okay, it's hard to give directions for the library in UTH when you don't really know how UTH is. So it's easy for you to know where the library is. Just go to UTH and ask anyone who is at UTH to say, where is the UNZA library? They will show you where the library is. As simple as that. Then the other question was?
Does the school provide any means of attaining extra credit points?
Extra points? No, there's no. I've never heard of such a thing, Doctor. No, there's no such a thing. All the marks you are getting them from the test and the exams you'll be writing. Yeah, I think we can call it a day, right? I think we can call it a day for now. Thank you very, very much for attending this session. This session has been recorded. I know there are others that are not aware about this, but it has been recorded. Hopefully it has been recorded. It will be put per Google Drive so that others can watch the recorded session. And then I'll be able to share the link to the books. You can download them if need be. Okay, or you can just be going and taking what you want. It's up to you. Otherwise, thank you very, very much for attending this session. And all the best. I will see you in January. Classes will commence in January. Let's enjoy our festive break. All the time. Let's enjoy our break. Once the Christmas break is done, we'll come back and we'll start learning. Have a good night, guys.